Bismillahirrahmanirrahim. Iyyaka na'budu wa iyyaka nasta'in. Good evening to all of you. I'm I'm pleased to see you, all of you. So let's start today. This is for new candidates. There's one request that please take your one page and a pencil to note all these things, because if you will not note all these things, you will remain and that will be a problem for you. So it is a humble request that either you put it on your phone or your on your page, so that it may be easy for later on. It will be a detailed session, and maybe continue for 40 minutes to 1 hour. So let me start with my presentation. Bismillahirrahmanirrahim. So first of all, let me that why have we created this forum, and what was the idea behind all this. The thing is that when we were preparing for Mrcs Part B, when we were in preparation period, obviously it is a costly exam. Almost all Pakistanis have paid more than 400,000. So it is a costly exam. So the thing was, we were not guided in a way we should have been guided, because we were the almost second batch for the Pakistan from the Pakistan in the Pakistan exam number one, and on that at that time it was not that common in Pakistan, because you had to travel abroad for this exam, and most of the candidates approach through you can say plab and not through Mrcs. So that was the reason. And those who had cleared Mrcs, they have traveled back to UK or other countries. So we were not guided. And if we had to take some guidance, we would should have taken it from Sala or from other, European or those Arabian countries. And those were obviously costly, almost nowadays more than 1 lakh. That was a big burden. So that is why we created this forum to help our Pakistani candidates. And we hope that, inshallah, with the help of Allah Almighty, we will continue this effort till we are alive, inshallah. This is our aim. So let me now. Our team consists of Dr. Waji and Dr. Farhad. He is consultant neurosurgeon. Dr. Hamza, Dr. Akib, and myself, Dr. Zulkarnain. So let's start that which stations come in the exam. That is important. That there are total stations about 17 stations, 8 stations where you have knowledge part, and then 9 stations related to your skills part. So 8 and 9, 17, and each station will be marked with 20. Each station will be of 20 marks. So this knowledge part, that will be of 20 of 160 marks, and this skills part will be of 180 marks. You have to pass these two parts separate. If you are failed in knowledge part, you are failed in the whole exam. Similarly, in the skills part. So what is the passing percentage? There is no fixed percentage. It is percentile based. Usually it is almost, you can say about 120, around 120, 120 in the knowledge as well as skills part. So it is not fixed ratio. It is because it is on percentile basis. So this is about the stations. Exam is being conducted in Pakistan as well as in the Gulf countries, in UK and Sri Lanka and Malaysia. So these and also Egypt and Egypt. So these are the countries where this exam is being held. In Pakistan, they are previously in 23 there were 4 exams in May, September, uh, this November, and then now February. So hopefully in this year they will be also in the four four exams hopefully. And however, one thing is that booking is totally on your luck, your good internet conditions, good and you're on your leg. So because there's lost lot of people to appear exam, one thing that is important is we have had requested them in almost November, would say, to increase the seats. So after that, they had increased the seats from 80 to 120. For that, we are thankful to Royal College of Surgeon Management. So in what is the knowledge part? We have anatomy, pathology, and critical care. These are three anatomy, pathology, and critical care. In the anatomy, there will be 3 stations, pathology 2 stations, and critical care 3 stations. Anatomy, pathology, and critical care. So a total of 8 stations and 120 marks. Oh, sorry, 160 marks. And one thing is that what you have to study for the anatomy and how the exam will, the stations will come in the exam. For the anatomy, one thing is extremely important. It is not anatomy like in the part A, where you have been be asked about the theory. It is about spotting. You will be given, maybe given a model, you may be given some pictures, and then you have to spot those things and label them on your in front of the examiner. So this, as this is, so all the stations will be interactive. There will not be a single station that is you have to write on paper. All the stations will be interactive. Examiner will be sitting in front of you, and then you have to answer the questions. So maybe there is, as in UK nowadays, they are giving some models and you have to spot on the models. Similarly, in some Dubai exam, they gave the models. But most of the time, they have only pictures. There are only few questions, few things which they ask you to spot on the models. And those pictures we will also come towards the books, from which book you have to study. I will explain it. There may be some diagrams, pictures, and radiology. Then they also give some X-rays, that important X-rays to identify the structure, or if there is some abnormality, they will ask you to explain that. The questions will be clinical. It is not theoretical. For example, if they ask you that, for example, they ask that there is a fracture, and then you have to point out that fracture on that picture, and then you have to show them that abnormality. And normality in the picture and then to show them. Similarly, in the anatomical spots, they will not ask you a simple theory question. For example, they will not ask you what are the structures of anatomical snuff box. No, they will ask you, okay, what is this? What is this? You will say, this is anatomical snuff box. Okay. Next question will be, what are the structures? And you have to point out or show them those structures in the snuff box. So it is not simple theoretical exam. It is basically a practical exam. For pathology, there is will be a scenario that will be given to you, and then you will be asked about the histology of that particular part, pathophysiology, etiology, relationship to the surgery, and treatment options. But you will, in some cases, you may be shown, not all, remember, not for all cases, but for some cases, you may be shown some histological diagrams and you will be asked to uh, diagnose that which abnormality is this one. For example, if they show you that this is a case of parathyroid adenoma, and then they may show you some histology or pathology. So the pathology in the picture, but it will be already clear and vivid to you that it is related to parathyroid adenoma, and these will be the findings. But it is very rare. It is not they will show you some histology. They will ask you for pathophysiology, similarly for the etiology, relationship to the surgery, and some treatment options. For the critical care, again, there will be a scenario and they will ask you what is the diagnosis and what is the, how will you manage this case. They may show you some x-rays, classification and causes, management option, pathophysiology, things will be asked. Now, the main thing starts from here. Now, what books do you have to study for anatomy? For the anatomy, main important thing is Sala notes. Sala notes, you have to memorize all from the Sala notes. Number one, that should be on your fingertips. If that is on your fingertips, no one can fail you in the exam if you have reproduced in a good way. If that is not clear, but the problem is with Sala notes and all these Turkey notes as well as the other notes. And we have covered that also in our lectures and also other things, that in the Sala notes, they have given less numbers. All pictures are almost same in the Sala notes and Turkey notes. So they have less number of pictures, and those pictures are not in the Sala notes. And but these questions and these pictures come, those pictures will be covered from the Meckman Atlas. From the Meckman Atlas. Obviously, Meckman Atlas is a big book. It contains almost, you can say, I think 1,000 or 700, 800 pages. So obviously, you cannot go through all these pictures. So what you have to do is that those questions which are asked in the Sala notes, you have to search for those pictures in the Meckman Atlas. Because in the exam, they will not ask you a theoretical question. They will ask you that thing, that structure in the diagram. So that is why, which for questions, if there is no picture in the Sala note, in the Meckman Atlas, we try our best to cover in our lectures. I think I have uploaded also multiple of them in the classrooms. And so you will see, it is very simple that you read from the Sala note and then search for those pictures related in the Meckman Atlas. And also I have uploaded all the pictures in the February and May classrooms. Some things which are not clear, if something is not clear, you can search from the reference book, that is the Gray's Anatomy. You should search from there. I would not prefer other books over Gray's Anatomy. For example, some say Snell's or second this rough rate. I would not recommend at all, because in the Gray's Anatomy they have explained with the help of pictures. So that is a big sport for the anatomy. This you have to do for anatomy. One more thing for this preparation material is sing notes. After you have done with Sala notes, after you have done with Sala notes, you you must go for a revision from the sing notes. SING. These are shared in the group, and also on my Telegram, I have shared there. So sing notes must be done. Why? Because examiners ask same questions in different ways. And in the sing notes, the important thing is that they have written almost all of those questions. Almost. There are some extra questions. You can say 10 to 10, 20% those questions in the sing notes. So you must do those sing notes, must give a read after you have done with. But again, I would say, first of all, Sala notes must be on your fingertips. If these are not your fingertips, then you cannot blame that the exam was difficult or something else. Hello, Dr. David. Dr. David. Hello, Dr. David. Okay. So you should go for the, I was saying that you have to go through all these things. Then you go for other notes. For pathology, and as for those notes related to uh, critical care, those notes in the Sala notes, those are sufficient. Some case, there are some use obviously being added each year. One or two cases are added. For example, recently there is a case of actinomycosis they have added. Then they have also added about the phimosis and hemophilia. So I have made those notes and shared in the group. So new cases, if the new stations are added, we try to cover them and to help all of you with the help of those new stations. Okay, this is all about the preparation. Second thing is that how would have you need to prepare these cases for these 8 stations. I would say, and this is our recommendation, and we are to do that. It should be by yourself, and in the other rate, in the second rate, you must do with a partner. You should not do it alone. Why? Because in the exam, there will be almost 20 questions on one station. One station will be of 10 minutes. I will come to this point later on, that how the exam will be conducted and how you have to cover those stations. But how to prepare now? Because in one station, for the 9 minutes, you will be asked almost 18 to 20 questions. And in the anatomy, these may reach more than 25 even. So what you have to do, and you have to cover all those questions in the exam. I should quote here that these stations are just, these questions are just like coins, and each coin is of only $1. Have to collect $20 at each station. It's not that there will be one question and that one question will be of 2 marks or 3 marks. No, there will be 20 questions or more than 20 questions, and for each question there will be only 1 mark. Okay, so what you have to do during your preparation is that you have to verbalize, and you will go in the you will go in front of the examiner, and then when you will go in front of the examiner, you will be asked questions and you have to answer them. If you have not practiced during your preparation that how to answer in the exam, you will not be able to answer, because there will be bombardment of questions on you in those 9 minutes and you will be puzzled. So my humble request is that during your preparation, take your partner, make your partner, and practice with the their partner. That will be extremely helpful for you. It will save your time, save your energy as well, and you will be able to pass this exam only then. Okay. Now, how this exam will be conducted, about the knowledge part, these 8 stations. So let me get if this is helping us. Yes. So for example, if this one is the cube, okay, and you are standing here, okay, standing here. So on the outside of the cube, there will be a question that is pasted. Here will be pasted a question on the door of that cube. Okay. You have to read that question for 1 minute. For 1 minute. And the here exam, there will be one examiner, and you will be sitting in front of him and answering the questions. And here the number of minutes will be 9, and you have to answer almost 18 to 20 questions. For example, if there are 18 questions, it means for one question, you have only 30, not 30 seconds exactly, you have only 20 seconds. Only 27, because in 10 seconds, this examiner will ask you the question. And in the next 20 seconds, you have to answer them. So to answer the question in 20 minutes, in 20 seconds, what you have to do, you have to take that question, then run in your software, and then to verbalize. This is really impossible if you have not practiced before the exam. So my advice and request, you can say, as being your brother, I would say that give one read to the book, and in the second read, make one of your good friend as your examiner and become his student or candidate, and start preparing like that. Is the only technique that is uh, valid and possible to ace the exam. Okay, this is for the knowledge part. There is no need to go for the extra books until unless you have already done all the stations mentioned in the Sala notes. Okay, So if anyone has question related to the knowledge part here up to here, please ask me the question. Hello? Any question? Am I not Dr. Dilawar? Dr. Dilawar?
Yes, sir.
Am I audible or not?
Yes, you are completely audible.
ओके ओके मुझे लगा कि आवाम सो रही है या मैं गलत बात कर रहा हूँ.
No, 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 no. I am just curious about one question that what sort of questions will they be asking about the anatomy? Is it all about the picture or
Yes,
anything else?
all about the pictures.
Okay, okay. Thank you.
Yes, each and everything. They will ask you, show me this structure, show me this structure, or they will ask you, what is this structure? They will give you up, for
Okay,
example, a head. If you, they have given you a head and neck picture, they will show you a picture and ask you, okay, where is the external carotid artery? Where is thyroid gland? Where is inferior thyroid artery? Where is superior thyroid artery? So it is like that. Where is recurrent? So it is like just like that. Dr. Dilawar, I think there is some problem with your internet.
yes, sir. I have got two problems: one with the internet, another with the power of my phone. But thank you so much.
Okay, let's move to the next part. That is the skills part. डॉक्टर संजय आप तो नहीं आए ना. Yes, Dr. Zari.
Yes, hello, sir.
Yes,
Sir,
please.
you told about the SING nodes. For which portion of the like anatomy pathology or what we have to do from the SING nodes along with the SALA nodes?
All these things.
All the three?
Yes, all the three.
Okay, then the second question is, you said we have to go through the Sala notes first, like A to Z, and memorize everything from that. So, if we are doing this, like memorizing everything from the Sala note, should we carry the Sing note along with that, or first complete the Sala note A to Z, then at the second read, we will do the Sing notes?
Excellent, excellent question, Dr. Zari. My request and recommendation is that first go through Sala notes and then read the Sing notes. Because when you will first read the Sing notes, then there may be incomplete answers to your question. But once you have done with Sing notes, you will easily understand what the is asked in the Sing notes.
Okay, if the even if the only the pictures are extra in the Sing note, we have to just do the Sala note first and see remaining pictures that are left after the first
Yes,
read of the
yes,
Sala.
yes. There are some extra pictures in Sing notes. There are
Yeah.
some pictures, and you should do that. You should do that. Those
After that, right? After the Sala first.
after the Sala notes. Yes.
Oh, okay. Thank you so much.
Because in the Sala notes are easily understandable, managed well, arranged in a good manner. So that is why these are mostly used. Yes, Dr. Yavinder.
Assalamu alaikum. I just wanted to ask, I joined actually a bit late, so will you please recap the this resources in the end, the
Sure,
reading resources?
I will, and this recording will also be available. No problem.
Okay, thank you very much.
No problem. Okay, so let's continue. with our second part, that is related to the skills part. So in the skills part, this skills part is also it is also of 9 stations, and these 9 stations are further subdivided into 4. Please write these very carefully, because then most of the questions will be answered already by you. Okay. These are 9 stations. Number 1 is, I would say, history. Okay. Number 2, I would say that is communication skills. And number 3 is examination. And number 4 are surgical skills. Examination and then surgical skills. Please wait a second. Okay, so all of them carry 2 stations except examination, which has 3 stations. So 2 into 3 is equal to 6. However, in the examination, there are 3 stations, so total 9 stations. Each station contains again 9 marks and 9 minutes in the, 10 mark, 20 marks, 20 marks for each station. And for each station, there are 20 marks and inside the cube, 1 minute outside the cube. So this is how it will be conducted. Again, 180 marks, and out of this 180, you are expected to collect at least 120 marks, at least 120 marks. So this is this skills portion is considered somehow more difficult as compared to the knowledge part, because someone is not guided properly or not have not practiced normally. So out of 180, almost 120 is safe score to pass this exam. First of all, there is history. Okay. Second thing is recommended books for the skills part. One thing is Bazid notes. These are available for all the 3 things: history, communication skills, and the examination. For the surgical skills, the book recommended book is Andrew Miller. Andrew Miller. This is the recommended book for surgical part. Again, write down, please. For the history, counseling and clinic communication skills, examination, this is, and for surgical skills part, it is Andrew Miller. That is important. Plus, for the examination, you have to look for Jicky Maddox video. Jicky Maddox videos. These are extremely helpful. So what will be in the history? In the history, there will be 1 station outside the cube, and you have to read that question in 1 minute. And then inside the cube, you will be having 9 minutes. You will be having 6 minutes to complete the history from the patient, 6 minutes. And then there will be 3 minutes to present your case and answer the questions asked by the examiner. So this will be your case. 1 minute outside the cube, 6 minutes inside the cube to take the history from the patient, and 3 minutes to present your history and then to answer the questions asked by the examiner. This is about the history. There will be 2 stations to a total of 40 marks. In the communication skills, there are 2 stations again. One will be called to the consultant, and the other station will be counseling of the patient, So What will happen in this? In this station, there will not be one cube. There will be two cubes. In the one cube, you will read the question for 1 minute outside the cube. Inside the cube, you will have 9 minutes to read the file of the patient. Okay, 9 minutes, you will have 9 minutes to read the file of the patient. Then you will enter the next station and there will be again 1 minute outside the cube. Same question will be pasted there, and inside the cube you will have to consult the patient at one station, and uh, you have to consult the patient. Okay, and there will be 9 minutes to consult the patient. There will be 9 minutes to consult the patient. This is one station, that is counseling. In the other station, where is call to the consultant. Call to the consultant, this one room, there will be one cube out here. You have 1 minute outside the cube again to read the question, and 9 minutes here to read the file of the patient. This is not the same file. This is a new file, new case, and new patient. So there will be 9 minutes to read the file. Then after these 10 minutes, you will enter the next, again 1 minute outside the queue, and inside the queue, there will be a phone. There will be a phone, and you have to call to the consultant and then explain to the patient examiner that what you have to do. So this is how communication skills part will be conducted. Basically, when they mark, the marking is that these history and communication skills, counseling and call to consult, these are part of communication skills. These are parts of communication skills. So this is how they have divided. Next thing is examination. Examination will be just like history. 1 minute outside the cube to read the question, and inside the cube you will be having 6 minutes to complete the examination. 90% of the time these are simulators. However, sometime, like in recent some exams, they have also provided some real patients. For example, for hernia patient, they have provided real patient. So this is important, that outside the cube 1 minute, then 6 minutes inside the cube to complete your examination, and 3 minutes to present your case and to answer the questions. Last one is surgical skills part. Surgical skills, for this you have the book, and you have almost, I think there are a total of 7 stations related to surgical skills. 7 stations, surgical skills. And you have here 9 minutes to complete that particular skill in 9 minutes. And the viva for the question will be during those 9 minutes. The viva for the question will be for that station will be during these 9 minutes. And total, there are 9 stations, so 180 marks. 180. However, in recent some stations, they have included one extra station, but they said that this extra station will not be marked. We have just included it for practice purposes. So, but the stations which are marked are only 9 stations here and 8 stations in the knowledge part. So I have told you the books again. The practice in both knowledge as well as in the skills part matters the most. Most you have practiced, easiest will be the exam for you. Okay, now any question, please? because there should be some questions so that I may know that you are all listening. Yes, please.
Sir, when we have to prepare for the skill section along with the knowledge, or is it okay to do the knowledge portion first, then the skills? Because most of the time we don't have partner for that much long time to go with us.
Yes, you should do knowledge part first and then skills part. Uh, eh, but I think that you should go side by side, because I have also shared the schedule and we go side by side. That will be easy for you, because you will not be saturated only with one station or one book. So there will be a shifting of the topics as well as of the stations. It will be easy for you if you go side by side. Yes. Are you satisfied, Dr. Zari, with this answer?
Yes, sir, but I was only concerned that sometimes we don't have any partner like on a regular
Yes.
basis. That's why.
Yes, for partner, what we used to do was, for example, for the history, I used to practice with myself or in front of mirror. If you don't have any partner, you can do it. Second thing is that you can do practice online even, as we take the sessions as for the May, those May candidates or other candidates, we take the session online and we ask the questions similarly as in the exam. So you can do practice online even. Even for the examination portion, examination part, you can practice. Why? Because in the examination part, the main thing is that how you give command to the patient.
Sir, how we give the command to the patient, I agree on it, and but I think the other thing is how we do the movements and the examinations.
Yes, yes, obviously these are important, no problem, no doubt. These are important, that how you give, and that is why I asked that you must have a partner with you for the practice. But even more important than these movements of the patient, more important is your communication skills. In the examination, even 60 to 70% marks in the examination are related to your questioning, answering, and communication with the patient.
Yes, sir. Thank you.
Yes, main thing is communication, how you communicate
Dr.
with the
Zulkarnain
patient.
sir.
Yes, please, Dr. Imad.
Assalamualaikum sir. Sir, I'm from Bangladesh.
How are you, Dr. Imad?
Alhamdulillah, I'm fine, sir. Sir, actually, I was wondering if this meeting can be found, recorded version, because I'm from Bangladesh. I
Yes,
just,
this is
came from
recorded. This is
the hospital.
recorded, and I will
So I'm
upload
on
on
Victor
YouTube.
Road.
Yes, yes, Dr. Imad, don't worry. This is recorded, and I will upload it on YouTube, and will provide you the link. Don't worry.
Thank you so much, sir.
Okay. Any other question, please?
Sir, can we get any assessment paper that the examiners are marking on, like they are focusing on what thing, like
Sorry, Dr. Zari.
as,
What did
sir,
you
as
ask?
you said that sir, as you said, for the examination, the communication is the main focus of the examiner, how you are communicating with the patient.
Yes.
So so similarly, if can we have any uh, like they mark how many marks are for the communication, how many marks for the examination, and all this, like step by step. Can we
I
have
have
this assessment
uploaded.
paper?
Yes, sure. Thank you so much, Dr. Zari, for your question. I have uploaded my guidelines on in the group, and in that group, in those guidelines, I have shared the pictures. You can read, and
Okay, sir, that's
you
great.
can find. Yes, you can find it there.
Yeah,
Yes,
thank
Dr.
you.
Omer, you have a question. You had a question.
Assalamu alaikum. Brother, I just want to ask that
Yes.
is there any demo classes like you told us counseling, how to make counseling and how to communicate. So all these sessions, have there any
Yes, yes. Thank you so much, Dr. Omer. I have uploaded these demonstration.
they prepare the exams and how they
Thank you so much, Dr. Omer. I have uploaded these stations and these all the guidelines, all the things I have uploaded in the classroom. These are available. And second, we when we conduct our mock, we conduct exactly according to the exam. So in our mocks, in our exam, in our classes, we conduct according to the exam. Second, I have uploaded all these stations almost in the how to take the history, how to sit, how to communicate with the patient, all the skills.
Sir, for I think there is September a time in the Pakistan. So when you are going to have workshop like mocks?
I one thing just want to make it very clear. I don't conduct mock exam in the for hands-on mocks. I don't conduct those hands-on mock. Why? Because mock exam, you should be prepared well beforehand. What I conduct is hands-on sessions. These are training sessions I conduct almost for 3 days. For 3 days at least. I think these should be for 4 to 5, as the candidates are not ready for this, as the candidates are not ready for this 3 days workshop, 5 days workshop. So that is why I conduct for 3 days. The next upcoming for the September candidates, I think it will be either in the May or June. That ideal time, because it should be at least 2 to 3 months before the exam. Because the reason is that takes 2 months to build your reflexes and make it your habit. If it 1 month or 20 days before, just like in recent exam for the February candidates, because they were forcing me that conduct this workshop just 1 month before the exam, and then at the end of the third day they were regretting that it should have been 2 months before the exam, so that our reflexes are built exam schedule. So if I hopefully inshallah I will conduct hands-on session in June.
Sir, those session will be on site.
Dr. Zari, your voice not clear.
Sir, those 3 day session will be on site, like physically we will be present there.
Yes, yes, obviously. But
And sir, which
I have recorded the
yeah,
previous sessions, and
okay,
these are available in the classroom.
okay. And which city you are having these?
Sorry,
Sir, which city?
Dr. Zari, there is problem with your or mine internet.
Sir, which city you will be doing these sessions?
Okay, this depends upon the candidates. Previously, in the month of January, we had conducted in Islamabad, Lahore, Peshawar, and Karachi. So it depends upon the candidates because there were 100 candidates who attended the previous session for the January, and instead I asked all of them to be on one side. I traveled from one side of the Pakistan to the other. So it depends upon the candidates.
Like in the same month, you did all the 4 cities you have covered.
Yes, because there
Oh,
was
that's
no time for the candidates.
yeah. Then okay. And the sessions you are saying for the June, then we can, like you are starting the registration for that.
Yes, registration will start just as there will be opening of new seats in the Pakistan for the September. So already there are sessions going on for the May group. There are sessions already going on. So you can join those. One thing is that what I press those who have taken my subscription, this subscription is not for 1 month or 2 months. This subscription is till you pass the exam. So this is important thing. Those who have subscribed, if, for example, if one person, he unfortunately he or she fails in one exam, because passing percentage cannot be increased more than 60%. If my candidates, even my or those candidates who, if there is a group of 10 candidates, I tell them beforehand, only 6 will be passed, because this is on the percent, is not upon the percentage basis. So percent it is on percentile basis. It means it cannot be 60%. So I don't say, but one thing is can I provide is that you can avail this subscription until you pass the exam. Yes, Dr. Umar.
Okay, Dr. Sahab, I just want to ask you that please tell us about the dates of opening of seats for Part B, not only in Pakistan but also in other countries like Dubai, Malaysia, and Sri Lanka. So we do not have any proper knowledge about seat opening and about the expenditures, like how much we have money to if we have to attempt exam in Malaysia and if we have to attempt exam in Dubai, so there should be a dedicated knowledge about these expenditures
Okay.
and these exam strategies and
Thank you so
about
much,
their
Dr.
dates.
Umar.
So I just
Sure,
want to
sure.
ask about
Thank
that.
you so much, Dr. Umar, for your question. Thing is that even I don't know that when they are opening the seats. Even this is only Royal College who knows. But I will provide you the link. Do one thing that open the, make it your habit that you daily open that site and then search for the seats. But I have an idea that when the coming seats are coming, for example, I think there are June seats. There are June seats for the uh, Abu Dhabi as well as for the Cairo, and the coming will be in the August, for the August date in the Kuala Lumpur and all these countries. For the Pakistan, there will be September seats, and those will be announced most probably either in the last week of February or the first week of March.
Sir, is there any difference of passing ratio between the countries, like if we are doing in the Pakistan or in the Dubai or any other country?
Experience says that there is more passing percentage in non UK countries.
Sir, what about between the Pakistan and the UAE?
almost equal. My three candidates recently appeared in Dubai. Alhamdulillah, all of them scored 165 out of 180 in skills part.
And sir, is there any difference between booking the Part B exam from England or
No,
Edinburgh or Ireland like this?
you can book from any college.
Yes,
Because
sir, it
it is,
can be booked, but
yes, yes.
sir, is there any passing difference between these, like examiner,
No,
difference of examiners and
no,
okay.
no. Any other question? Okay, thank you so much. So our class for the May will start at 9 p.m. Okay, thank you so much.